Hello everyone, this presentation is about accurate dating of pregnancy and why it's crucial in the management of both low and high-risk pregnancies. Precise information about gestational age is fundamental in the assessment of fetal growth and diagnosis of fetal growth restriction. For the safety of invasive procedures like chorionic villus sampling and amniocentesis, interpretation of certain serum screening tests, to avoid undue parental anxiety, and for counseling the option of pregnancy termination. Erroneous estimation of gestational age is known to be associated with several adverse pregnancy outcomes. The most important are increase in perinatal morbidity, low birth weight, preterm delivery, increased incidence of maternal morbidity, especially from women of erroneously diagnosed post-term pregnancy, unnecessary testing and interventions such as fetal monitoring, prescription of unnecessary and potentially dangerous drugs like tocolytics. Gestational age assessment during the first trimester. First, date of the last menstrual period. Expected delivery date is estimated to be 280 days after the first day of the last menstrual period. Nagel's rule can be used to calculate expected date of delivery by subtracting 3 months and adding 7 days to the date of the first day of the last menstrual period. Factors that may affect the accuracy of estimation of expected date of delivery using last menstrual date. Many women do not have regular menstrual cycles. There is individual variation in the length of the follicular phase. Ovulation varies widely, from 8 to 31 days after the last menstrual period. Many women do not remember the first day of their latest cycle. Estimation of gestational age using ultrasound in the first trimester. Precise assessment of gestational age can be obtained during the first trimester. Before appearance of the fetal pole and the yolk sac, dimensions of the gestation sac are used. With transvaginal ultrasound, the sac can be seen from the 5th week of pregnancy. Estimation of the gestational age using the gestation sac might be inaccurate. Sometimes gestational age prediction errors of up to 2 weeks may occur. Confirmation of the gestational age at later age is always necessary. From week 6 onward, yolk sac and fetal pole appear. Like the gestational sac, their measurements only provide rough estimates of the gestational age. Accuracy of gestational age measurement with crown rump length is well documented. Embryo is imaged in the longitudinal plane. Calipers placed at the head and the rump of the fetus. 3 measurements taken and the average calculated. Several biometric parameters can be used for the estimation of the gestational age, the most accurate being the head circumference, the rest being the abdominal circumference, biparietal diameter, femoral length, and the cerebellar diameter. How measurements are made. For the measurement of the head circumference and biparietal diameter, the plane should include the parietal bones, the third ventricle and the thalami. Calvaria outline should be symmetrical and cavum septum pellucidum should be visible. For head circumference, calipers are placed on the outer margins of the bone, but for biparietal diameter, proximal caliper is placed at the outer margin and distal on the inner edge of the bone. AI-generated calipers should be adjusted if their placement is not precise. While head circumference is accurate by itself, the precision of the estimation can further be improved by adding one more parameter, abdominal circumference or femoral length. When measuring femoral length, the transducer should be aligned and parallel with the proximal femur. Only the osseous part of the diaphysis and metaphysis are measured. Epiphyseal cartilages are better visible in the imaging plane but should not be included in the measurement. The abdominal circumference AC measures a transverse section of the abdomen. It should include the stomach, the mid-third of the umbilical vein, the descending aorta, intact skin edge, the transverse spine, and a single rib on either side. Estimation of the gestational age during the third trimester ultrasound. Third trimester ultrasound dating is unreliable due to variations in fetal growth rate. Biological variations among fetuses increase with advancing age. Third trimester evaluation of the gestational age should be used with caution. Estimation of the gestational age in twin and triplets. In twins, the most precise result can be obtained by calculating a single averaged measurement of the gestational age. In triplets, 1 day is added to the mean of the largest and shorted gestational age. In the first trimester, if the difference between the predicted expected date of delivery based on last menstrual period and ultrasound measurements was greater than 5 days, the sonographically estimated expected date of delivery is preferred. In the absence of growth restriction or congenital anomalies, ultrasound expected date of delivery prediction should be preferred over the last menstrual period, if in the second trimester, there was a discrepancy of over 7 days. In the late second and third trimesters, and in the absence of proper ultrasound documentation, current gestational age can be calculated from first trimester ultrasound scans. An online due date calculator is helpful for this purpose. If conception was with IVF, EDD should not be modified based on U.S. What else to remember? When the expected date of delivery is established, it should not be changes based on a second or subsequent ultrasound examinations. If the gestational age assessment of 2 consequent ultrasound examinations was discordant, intrauterine growth restriction, macrosomia, or other pathological process should be considered. If one of the biometric indicators, like abdominal circumference or femoral length, was not clearly visible, another indicator should be incorporated in order to ensure precise assessment of the gestational age. Whenever appropriate, several measurements should be averaged to ensure a precise assessment of the gestational age.